Michelle is a gold ambassador on our team, and she is my mom's level 1, so Michelle will be my level 2. Okay, and stand right here so they can do one line up to see you.
Oh, here?
Yeah, well, this is the computer so they can see you. Yeah.
Okay, so Dawn did a great explanation of my background. I've been a stay-at-home mom, post a really exciting career in nursing. I did organ transplant, both sides, and neuro ICU. And then got married at 34, had 3 kids, and stayed at home for 18 years. So this was really exciting because of college. I was starting to look at jobs, but I still have a daughter who doesn't drive, who dances 7 days a week sometimes, and needs rides to all of that. So I kept trying to figure out what was going to be flexible enough. And I knew I didn't want to go back to the hospital because I'm older now, and I know what's facing me there. So this came just like at a really opportune time. And I'm here to tell you that it has already made a significant change in our finances as far as being able to keep putting my check to the side toward college. So, okay, Plexus product information. I was counting products, and I got 13 because I forgot a couple. One was, I didn't include the breast check kit or the body cream. So, the breast check kit isn't used as frequently. It's easy to see what it is. It's a proprietary, did you ever open yours up?
No, that wasn't it.
Okay. Can I open it?
Sure.
Just to show them? This was featured on the doctor's show when that used to be on at the time, and I remember it because my mother had breast. I have a mother and two out of 3 of my sisters had breast cancer. So this kind of was weirdly ironic to me too. I was like, I think this is a message. So the theory behind it, this is that a woman can place it over her breast, and it helps. There's like this kind of fluffy gel inside. It helps pick up lumps and bumps, makes it easier to feel. So the reason I put the number was because it's doable. It's not like we have, as Dawn said, a catalog of things to learn. Okay, they're pretty simple. What's hard about being a medical person and doing this is that these are considered, they're all natural plant-based products. They come from natural plant-based combinations and whatnot, so it kind of is a little bit of a stretch for me, but I go to a holistic physician, an internist, and so they spoke to me because she also, I was going to say pushes supplements, but she doesn't push them, but she will turn to supplements frequently instead of a prescription drug if it can treat a situation. So Plexus Slim is also known as the pink drink. Why was it developed? Mainly because of the obesity epidemic. It's estimated that 1 out of 3 current 20 to 30-year-olds will be obese and develop diabetes in their older age. Also, and we all know excess weight contributes to hypertension, cardiac disease, increased risk of stroke. And the main thing they were trying to do with type 2 diabetics was to help the pancreas function more effectively. Because in type 2 diabetes, the pancreas is still working, it's just not working as well. And that's why there's a need for insulin. Or some of these other types of blood sugar products that people take. So who is Plexus Slim for? Anyone who desires weight loss, balancing of blood sugar, better sleep, clarity of thought, for good sustained energy. And this is, okay, so this was eye-opening for me to do this preparation for this because I think that it's commonly thought in Plexus that this is all about weight. Look, the pink drink's going to help us lose weight. But I think we can start to think of it more as a body balancer. I guess in my thought process I had, well, I'm going to use it, it's going to help me control cravings and hopefully lose weight that way, and therefore I'm going to feel better. But the actual ingredients that are in Plexus Slim speak to sleep and less feeling of stress, a body calmer. So, therefore, and one of my best friends in Pennsylvania, who's an ambassador of mine, is on my team, takes it, she's one of those narrow girls, Betsy, who works out every morning, looks like $1 million, but was always fighting herself at night, turning to chocolate, starting this pattern of chocolate. So she's been on it for quite a while now just for that. She does Slim and X Factor vitamins. Okay. What is Plexus Slim? It's a combination of natural plant extracts. And then I wanted to go through like the 3 main ones because I think we tossed some of these terms around and we're not really sure what we're talking about. Chromium picolinate is a mineral found in foods, and it works together with insulin to metabolize carbohydrates. So that's why it works. Hello? Who's talking? Is it conversation? Oh, okay. It's used in alternative medicine as an aid in controlling blood sugars. So you can see why it's important in the Slim and why Slim does what it does. Alpha-lipoic acid is an antioxidant. It's used for diabetes and nerve-related symptoms. And this is why this was like kind of eye-opening to me because of my personal situation with my husband who had 2 herniated disc surgeries back-to-back a year and a half ago, within 30 days of each other. He was having such significant nerve damage so fast after the first surgery, didn't quite do what it needed to do, that they had to go right away back in. And people start to feel better with some of these issues just on the Slim. And I think you can see why these ingredients speak to that. Also, what else? I think that's it on that. Alpha-lipoic acid also seems to help increase insulin sensitivity. So the insulin you have, you're more reactive to, even if you're not putting out as much with that as in diabetes and type 2 diabetes. And it may be useful in addressing metabolic syndrome. And I did hear that word passed one time on one of my doctor's appointments, which is a scary thought, but I had to look it up because I was like, look, I know it's not good, I know it has to do with abdominal fat, but what really is it? And it's a group of symptoms, the baddies: high blood pressure, creeping up blood sugar levels, abdominal fat, and a little bit of an elevated cholesterol. So I think in my situation, my doctor probably was starting to talk and I was starting to kind of look like I was headed in that direction, and it's not a good combination. Now, the other one that we toss around is green coffee bean extract. So I was thinking, okay, so that's where the caffeine comes from and you feel a little bit of extra energy, but it gets kind of interesting. Green coffee bean extract decreases the body's absorption of fat and glucose. It's less than 2% natural caffeine, but where it kind of becomes interesting with Slim is that it's a major source of CGA, or chlorogenic acid. And this is anti-inflammatory, the chlorogenic acid. So that's where I think my husband was starting to feel some relief of his symptoms, subtle, or why we just start to feel better overall. It's an antioxidant also. And the final thing is Plexus Slim is sweetened with stevia. Note to self about stevia. If it's related somehow with the ragweed family, so if you have customers that are saying, if they tell you at all that they're very allergic to ragweed, I wouldn't suggest Slim. But if they start to have symptoms, don't poo-poo it, because I do have a lady, and she knew herself that she was allergic to, she was sensitive with her asthma to certain supplements. So she desperately wanted to do the Slim and she couldn't. I mean, like within 2 days, she was all puffy, and her sinuses and her breathing, she was getting wheezy. So that might save you some time researching. Okay, how and when do we take it? comes to your customers and to you like this. It's a 30-day supply of the little packets like Crystal Light. Most of you guys probably know that. Most people take 1 stick a day. You mix it in 8 to 10 ounces of water. And then, I'm going to say no questions or comments yet, because I know there's a million varieties of various ways of doing this. But this is from the horse's mouth, from Dave Brown. You drink it within 15 minutes of mixing, drink it all at once, and drink 15 to 30 minutes before the meal, your breakfast. Okay, so I didn't do any of that. Like the first 4 months I was on it, and I lost probably 15 pounds, lost my inches. And that's really a hard thing to get across to rule follower type people, which I usually am. But I liked it more dilute, so I put it in a much bigger cup of water. I put ice in it. I shake it up in a shaker bottle, and I would drag it around with me all morning long, in the car, out of the car, and kind of just slug it down when I felt like it. I do think it's important to try to drink it within those 30 minutes. And the other thing that I would, I know that there's talk about if you've had a lot of fluid already and then you drink it, it's more dilute when it goes, your gut has fluid already. So Dr. Harris, who's our medical director of Plexus, in one of his videos, he says that he gets up, he drinks a Slim and takes an accelerator. Just get it out of the way. Okay, but I tell new customers that I just, as a general rule, any kind of vitamin, anything you're taking, I do think it's good to have something in your stomach. So I would eat something shortly after that. And it did, I did read that all those rules being said, it's still effective and can be beneficial regardless of when you take it. For people who have trouble keeping weight off, 2 sticks can be beneficial. And just because we kind of like it and it tastes good and I think it helps in general, Lance and I, my husband, have been, most days we do 2 a day. The second one I try to do about a half an hour to an hour before we eat dinner. I think it helps me eat less, because I'm a little bit fuller. Now my kids, I'm sending it to my son in college. He's drinking it as kind of a natural energy source. Rather than, I just told him that I'd rather have him cut down on coffee and tea at night to stay awake if he's studying, and he loves it. So, when can you see results? It depends on what your customer's goal is. So fat loss, usually 2 to 3 weeks, there should be some result. Maybe it's just in kind of the beginning of a loss of visceral fat, so the person might not see results on the scale, but they might feel like their stomach is less bloated or full. That being said, some people don't see results for 3 or 4 months, so the trick is to try to get someone to hang in there long enough to see those results. Okay, so for blood sugar changes, usually within 2 to 3 days the person will start seeing changes, and the reason they know that is because somebody who's diabetic and is, absolutely for insulin-dependent diabetics, are checking their blood glucose like maybe 4 times a day, at least. So they know immediately that they can see the numbers on their meters and that they're taking less insulin. Lessened stress, better sleep, and curbed appetite, usually within a few days. And I can speak to that personally. The reason my husband started to borrow some of my Plexus Slim was because I was just feeling so much better, and I was like happy and excited to do this, and so now I know why. This is important. I thought this was kind of cool, that most weight loss programs involve some form of deprivation. And again, I'm a serial Weight Watchers, literally, I've got to get on board for joining, because I think I joined every year and then quit. I was lifetime when I was 30, which I stayed at that weight for about 2 days. So I could never get the lifetime discount again, because I never got back down there. But, or you have to exercise a lot, and it's difficult. So people they'll do it to get to a goal. And then once you get to that goal, it's like, back to your old habits. The cool thing about Plexus Slim, there's no wagon to fall off of. And that's where I noticed that also last summer when I was first starting, was that I didn't freak out if I overate or I had sweets or I had whatever. I just kept drinking my Plexus Slim and trying to listen to my body and take advantage of some of the cravings control. You can experience the benefits without drastically changing your lifestyle. I had terrible plantar fasciitis last year. I couldn't exercise. So I didn't exercise. However, it's important to exercise. Obviously, you'll see results quicker. No contraindications. Those 3, chromium and alpha-lipoic acid, they've been well studied. There really are no contraindications to any prescribed medications or other supplements. Okay, Accelerator Plus was the first kind of metabolism booster product that they came out with, Plexus. It's a companion product to Slim, so they go together well. Why did they do it? Why did they create it or see a need for it? Because it helps speed weight loss and overcome plateaus. Who could use it? Anybody who wants to maybe try to speed up their weight loss or a desire for better energy and mood. It provides balance that many find helps increase results, and I'm going to talk about that too. This was a very good learning experience for me, this whole thing. Who shouldn't use Accelerator? People who have high blood pressure or cardiac issues. Anyway. And people who are currently taking antidepressants. Check with your doctor first. And I'll tell you why. I know somebody who should go unnamed, who's been plowing through the last, I don't know how many months with this, who probably would be better off now. However, I've had no changes, or no negative side effects. What is it? It's a natural formula of plant-based extracts. The primary ingredients are hygienamine and hordenine. Hygienamine was used, for centuries by the Chinese as an appetite suppressant, and hordenine is a thermogenic stimulator. All that means is that anything that's thermogenic helps increase your metabolism by slightly increasing your body temperature. And then there's a couple other things: yerba mate, hawthorn, green tea extract, we see again, and chromium piconolate. These ingredients help boost the benefits of Plexus Slim, and that's why you'll see them described as Accelerator Plus working synergistically with the Plexus Slim to have weight loss. Okay, so I wanted to talk about 5-HTP. It's amino acid that helps calm the body. It's been used in the US and Canada for antidepressant purposes. And if you or your customer is on an antidepressant, it's personal, but I think you could throw it out there just in general. They probably are much better suited taking Boost as a metabolism booster. But like I said, I know someone very well who just has been taking it and is on, I am on a blood pressure product, but it's a diuretic. And I also have a little happy pill that I've been on, and I have had no side effects being on Accelerator. In fact, for different reasons, I prefer Accelerator. So we're not going to get into what can happen, which is something called serotonin syndrome, and it's kind of something that I've never heard anybody experiencing with Plexus or Accelerator, but just you might want to run it by your doctor if you should be on even more 5-HTP if you're already on an antidepressant. Okay, so Boost has been introduced since I started. I started in April or May, at the beginning of May, and I started on Accelerator, and then like within that month, Boost came out, so of course I ordered it because I wanted to try it. So it's kind of recent. It boosts metabolism, suppresses the appetite, and accelerates weight loss, just like the Accelerator Plus. Again, thermogenic type product where it's increasing your metabolism by slightly increasing body temperature. People who are looking for a metabolism booster but may not be able to take the Accelerator can consider Boost. Who shouldn't take it? People on high blood pressure medicines, again, should run it by their physician. Okay, what's in it? I love saying this word because they say it on the tape all the time. Carolina, which is an edible cactus that suppresses hunger and increases endurance. It was used by like Eastern Indians for years. I think it's so cool that these natural things that they had around them they could use and know that they could get more endurance by eating this cactus. Yerba mate, it's a stimulant, a diuretic, and it helps with weight management. And again, hygenamine increases energy. Okay, so I saw a great tape by a gal that's a master's in nutrition, and now is also a holistic nutritionist. And her suggestion was, if you're somebody whose main concerns are snacking too much and overeating, Boost should be the choice. How do you take it? 1 to 2 capsules, 30 minutes before breakfast or lunch. And everything I saw and read didn't make as big a deal about Boost being a companion product to Slim, that it could be, I even read that it could be taken alone. And we can talk later if you guys have questions, but personally, I find Boost to make me jittery. And I even tried it again last week, just kind of as a test. And I do feel a little speeded up when I take it. But I'm going to try it again this week because I want to see if I feel more appetite suppression. Black was just introduced like in October. This black inhibits 48% absorption of sugars and starches. Who can use black? Anybody who wants aid in weight loss. If taken as they recommend, some people will feel a feeling of fullness, which is 2 capsules, 30 minutes before your biggest meals of the day. The other people that might think about using it, although I don't know how this would work, but people with low thyroid who aren't on thyroid medicine could maybe get a little boost of energy because there's iodine in it. What is it? Starch blocker, and it's what we call a standalone product. If your people, I keep wanting to say patients, if your customers don't want to take the other products for some reason, or finances are an issue, this might be something they could try. Now, I wanted to talk about the ingredients just because it helps if you understand how block works. One of the ingredients is brown seaweed. It's high in iodine content. And this is where on some of the Facebook pages, I've seen a lot of discussion about, ooh, if I'm on thyroid, I can't take block because I have iodine, and blah, blah, blah. Okay, so, but to me it looks like a bunch of, like us sitting around a table, just kind of sharing, random anecdotal stories. So it would be good to talk to your doctor if you think that's going to be a problem. I'm on thyroid medicine, I take block, and my doctor had me on extra iodine because, again, it's kind of like some of these other issues we'll talk about. Her feeling is pretty much across the board, Americans are low in iodine, and it's important. Brown seaweed absorbs, okay, so I think about it like this, like it's a sponge in your gut. It takes up space, it absorbs fluid, and it helps us feel fuller. So it's kind of a mechanical thing that it's doing. The white kidney bean extract is the other deal that's in it, the other natural product. It inhibits, okay, so this helps inhibit the digestive enzyme amylase. Amylase is in our saliva. You'll hear sometimes people get amylase levels drawn or read for certain illnesses or disease states. And then also, of course, we have it in our stomach. It helps start to break starches and carbohydrates down. So it blocks that, or it inhibits, it slows it down, it kind of paralyzes the amylase. So this is a visual that's kind of hard to take, but the sugars and starches aren't broken down, therefore they pass through our system. They're absorbed naturally is how it's described by Plexus, and pass through the bowel movements. The nutritionist I watched her tape on block, because that was like her video, because that was kind of the most information I could find in one place about block. points out it's not a fat absorber. Remember when fat-free potato chips came out or whatever, and it said with that olestra, people were having weird bathroom issues? It's not a fat absorber like that. It's a starch blocker, so there are no funky bowel movements. I hate that word. Okay. How do we take it? Again, 1 to 2 capsules, 30 minutes before your 2 biggest meals of the day. I had to set an alert on my phone because, like, I don't know when I'm gonna maybe sit down and be able to grab something to eat for lunch. So around 12, I set an alert on my phone because I really do this kind of for experimental. Like, I want to know the products from myself. This nutritionist suggested that if you are getting blocked by block, because some people do experience constipation with it, to experiment, to make sure you're drinking enough water, and to maybe just take 1 capsule a day, or before a meal. And it's safe to experiment with, so. But I did, how do you go out on Facebook in the groups and say, is anyone else feeling blocked up a little bit? Because everybody is raving about it. So try it and see what you think. X Factor is this incredible vitamin that was designed by Plexus and put on the market. What makes it special is it's a patented aloe blend. So they have the patent on this aloe blend, and I don't think you can find another vitamin, multivitamin on the market that's blended with aloe. Also, really interesting what I read, for me, doing this, was Dr. Harris has a very long presentation somewhere I found, talking about X Factor. And one of the things he explains is, like in the vitamin industry, in the business, for like B12 alone, there's 9 different strengths. So if a company's going to design a multivitamin and they're picking B12 and they're picking this and they're picking that, they can choose from these different strengths. And as he pointed out, your highest, most potent strength, B12, is going to cost a lot more than your lowest. Okay, so Plexus uses all the top potencies of the vitamins that are in it. And the other thing he said you have to consider with a vitamin is how bioavailable is it? How is the body going to use it? Is it going to pee out like an hour later? You go to the bathroom and you're like, oh, there's my vitamin. Because you can see it and you can notice the smell, of course. So the aloe and X Factor increases the bioavailability of vitamin C alone by 304%. C is a water-soluble vitamin, so the theory is that if C is being absorbed that much better, then the other water-soluble vitamins are also. Vitamin E is a fat-soluble vitamin, which is much harder to work with, apparently, in vitamin form. And that bioavailability was increased by 369%. The other really important thing about X Factor is the New Zealand black currant extract. It's an incredible antioxidant with a very high ORAC value. I was kind of like, oh, what the heck is an ORAC value? That is oxygen radical absorbance capacity. So basically, it's how much can it help you neutralize free radicals, which are the end product of cell breakdown and all these different oxidative processes that we have going on in our body all the time. They're dangerous because most of them just pass through fine, no big deal, but they can help cause changes in DNA of different things, and that's the theory behind cancer starting, why we take antioxidants to help prevent cancer. So what else do I have to say? Okay, so free radicals are one of the biggest sources of inflammation too. You'll see a couple principles continually throughout these products. Anti-inflammation is a big one. X Factor is most available, is the most bioavailable market out in the market. Okay, Dawn, I'm probably gone so far over any time.
Oh, good. It's good.
Okay. Okay, so we're on to ProBio. Why do we need it? To promote digestive health, balance the GI tract. Modern lifestyles contribute to a lot of toxins. We're absorbing them through our skin. We're taking them in, on the plastic that our foods are packaged in. Several things contribute also to this: antibiotics, high sugar intake, and high processed food intake of the typical American diet. So what happens? All these things give you an overgrowth of yeast in your gut, which decreases the absorption of nutrients, which decreases immune function, and increases the risk of autoimmune disorders, including fibromyalgia, chronic fatigue, lupus, eczema, psoriasis, constipation, sugar, although that's not really an autoimmune disease, but these are some of the things that can happen. Sugar cravings, anxiety, and joint pain. So we need to, it works by repopulating the gut with healthy bacteria. What is it? 5 strains of beneficial bacteria. They're by the Probio5. There's 1 yeast in it that's beneficial. There's a lot. I would recommend also not wasting a lot of time on these Facebook things arguing about like why is there a yeast in something that's helping kill yeasts. Try to research it on your own, and because it's a beneficial yeast that's in it that's used as a probiotic. There's an enzyme in it to help break through the coat, the protein coat of Candida yeast, and there's an antifungal to help get rid of the garbage once it's broken down. How much Probio5 should you take? Okay, so I'm not going to go into the spit test other than there is a test that you can look up to kind of gauge whether or not somebody has Candida. And the worse it looks, the probably worse the Candida overgrowth is. So a person who needs to get rid of that has a lot of these other symptoms of Candida. Could start out with 2 at bedtime, working up to 4 at bedtime. But it's not the type of thing that you go to bed one night and take 6, because you can get severe detox symptoms, which are flu-like. Even with 4, when I started, I had a really bizarre headache for a week, and it was bugging me, and I thought, oh, I don't know if I can see through this. And I hung on, and it went away, and I'm clear of a lot of these symptoms now. Take 1 at bedtime for maintenance. My family, I make them take 2 at bedtime. Who can use it? Everybody. And also, yeast is really hard to kill. So as far as how long does someone stay on it, basically, I just did a spit test the other day, and it's not perfect. And I've been on it the whole time. So I just am staying on it because of the immune boost factor. My family's gotten through the winter with no illnesses. BioCleanse, this is like my favorite because of lifestyle toxins, sluggish metabolism, waste products build up in the gut, and faster than we can get rid of them. And also, most of us are deficient in magnesium. So this is magnesium and ascorbic acid. Magnesium helps our bowels to move. In fact, as my doctor gave me about like an $85 bottle of magnesium caps one time when I was complaining about this issue. But taking them like 1 or 2 at a time like I was at the time, it wasn't really helping my situation until this came along. And I'm telling you, I had this terrible IBS symptom of a slow gut, shall we say, or severe constipation for years. And between ProBio and BioCleanse, I'm like totally cured of that issue. So, and it was, it's very bothersome. Everybody should be moving their bowels 2 to 3 times a day in a perfect world. You can have up to 8 pounds of waste sitting in your intestinal tract at any given time. And so therefore, so you're kind of clogged is the only way I want to describe it. Here's your intestinal, all your guts. And if it's clogged up with even 3 days of waste, you can't oxygenate the tissues, the lining of the gut, because it's blocked. So there's a huge oxygenating factor of BioCleanse also. Something I read said, don't get hung up on the cleanse part. People, because it says cleanse, people think we're selling a cleanse. Yes, it helps eliminate, it helps elimination, but it also helps with energizing and oxygenating tissues. Amplifies the effects of ProBio5.
Michelle, wait, what does that say? The second thing responsible for?
It's my shorthand. 30 reactions in the body, 30 chemical reactions in the body. Magnesium takes place in. So when you're magnesium deficient, there's a lot of things being affected, simply put. Low magnesium some of the symptoms can be headaches, constipation, and joint pain. fast relief body support, fast relief nerve support, and the fast relief cream. Okay. Dr. Harris, our medical director, is renowned in pain management throughout the world probably. Started one of the major pain relief centers in Arizona. That's a very well-known center. So that's good to know. He was in traditional pain management his whole career, 40 years, and what he saw was kind of the end product of traditional pain management, was patients on a lot of heavy-duty pain medicine that was affecting how they functioned in life. Right now, 1 in 3 Americans is experiencing chronic pain, and there's 52 million people disabled from chronic back pain. So he wanted to look at it from a different angle. And he decided, since all pain is due to inflammation, so if you cut yourself and you get a red spot, that's an acute inflammatory response, it goes away. But with people with nerve damage, it becomes a chronic inflammation, and chronic inflammation is much harder to resolve. So, fast relief capsules, which I look at in terms of like Advil or Tylenol type things that we take. They and the fast relief cream work because of a substance in it called lipronol or eterol. ETA, which is trademarked, or it's a patent pending that he's got. It comes from the New Zealand green lip mussel, and therefore those two products, if you have people with shellfish allergies or sensitivity, cannot use those products. So that's important to know. It's a powerful anti-inflammatory. It's only found in this mussel, so you can't manufacture it, you can't find it in any other animal products or shellfish products, apparently. Again, you can look at the bottle for the dosaging. It's also, he was saying, a natural source of glucosamine, hyaluronic acid, and chondroitin. So think about when you go down the aisle at Sam's and you see all those separate products that you're buying for joint health. So a maintenance dose of 1-2 times a day can really help just maintain someone who's experiencing those kind of issues. Fast relief cream gives immediate relief from the outside in. It's got the eterol in it also. And what he was saying is that if you think about it, the fast relief capsules are helping someone kind of heal from the inside out. Fast relief cream is healing from the outside in. You get an immediate effect to the area it's applied. And then really about the nerve relief, what I want to say is there's no medication on the market that helps nerves heal. And as Dr. Harris explained, when he was in medical school and he was doing his training, the belief system was once a nerve was damaged, it was done. There was no healing it. But they've come to find out that there's something called nerve growth hormone that the body has to have in order to promote nerve growth. So nerves can heal and get better, but you have to have nerve growth hormone. So the bottom line with nerve support is it's a combination of natural ingredients that help promote this nerve growth hormone. I'm not going to get into everything just because we're running short on time, but this is important because it does, again, speak to me and my husband. It's something I want to point out. Nerve tissue takes the longest of any tissue in the body to heal. It's so slow. So he said, think about 1 inch a month. So if you have somebody with like a cervical spine injury and they have numbness and tingling down to their fingers, yeah, right here, you know, you can put some fast relief cream and maybe get some relief there, but for this to heal, 1 inch a month, okay? So it'd be up to 30 months before you'd see nerve healing. But there's something that can be done. Yeah, so that's the beauty. Without taking the other 3 drugs that are commonly prescribed for patients, which is one is an anticonvulsant and the others are antidepressants, and what people have to do is keep increasing the amount to get the same relief. Okay, that's it. Plexus 96, we're not going to go over. And these were the people I kind of looked at, if you guys want to see those names, and look up on YouTube or in the files on Diamond Destination, as well as our files in the pink. And one of the things I learned by researching some of this was that they really do work synergistically together, all the products. It's like kind of the whole picture that we need for health.